Medical Officer, distinguished partners, the I humbly call upon the Director of HFAC-SL to give a welcome address and overview of his people at the conference. Director.
Thank you very much, Mr. Samba, the Honorable Deputy Minister, Minister of Health and Sanitation, the Chief Medical Officer, Dr. HFAC-SL, the country representative of the UNFPA, the representative of the Interreligious Council, other distinguished invited personalities, colleagues from civil society, colleagues from the family planning kingdom. Let me take this opportunity on behalf of the management and staff of HFAC Coalition to welcome you to this very important conference on the repositioning of family planning as an agenda for prosperity. It gives me the greatest pleasure to invite you today to this conference and to heartily welcome all of you for accepting our invitation in spite of your busy schedules to be here this morning to participate and contribute to a national pledge to include family planning as a flagship project in the agenda for prosperity. As I welcome you all to this conference, let me state that Health for All Coalition is a civil society health advocacy network which is partnering with development partners and the government of Sierra Leone to ensure that the issue of development is critical in the lives of especially the most vulnerable, who are the women and children. It is in this regard that Health for All Coalition, in partnership and with great support from the UNFPA and the Ministry of Health and Sanitation, is organizing this conference for us to call on stakeholders present here and those yet on their way, for them to see reason to incorporate family planning as a flagship project in the agenda of prosperity. Let me recall your memory that the current government of Sierra Leone is in the process of preparing a second development agenda, which they call the Agenda for Prosperity, which is envisaged need not much introduction because of the enormous contributions they had and still playing to the development of the health sector, with particular reference to the family planning repositioning. I remember at one time, Chief Medical Officer of the Ministry of Health and Sanitation, Dr. HFAC-SL. Thank you.
Thank you very much, Mr. Mohammed, representative of Strategy Policy Unit, State House, UN partners here present, our development partners, traditional leaders, religious leaders, NGOs, colleagues of the health sector, colleagues of Health for All Coalition, distinguished ladies and gentlemen, the press. For me, it's a very, very big honor to make this homecoming, which
And I think by the end of today, we'll be having some food for thought if we had not just started seriously thinking or considering family planning as a key development issue. Sierra Leone has a population of 5.9 million people with a population growth rate of 3.1%. Adolescents and youth constitute 55%. Women of childbearing age, which is 15 to 49, they constitute 25% of the total population of the country. The total fertility rate is 5.1. When you say fertility rate, is the average number of children per woman. That's just an average, between some have 8, 9, 10, others have less. While teenage pregnancy stands at 33%, which is unacceptably high. Access to family planning services is abysmally low in comparison to other countries in the region and also globally. And I think Dr. Dao has already mentioned how we don't compare at all. For example, if you go to statistics, you'll find that Ghana is 23.5, is in the region, but it's fairly higher. It's more than the average that Dr. Dao talked about, which he said 15%, isn't it? We also in Africa, we have countries like Zimbabwe with 64%. And our own contraceptive prevalence rate is still 7%. Far, far lower than the average. Spending about 25% of its resources, of its entire program resources, to help governments to buy family planning drugs, which are the contraceptives and